In this model, I'm going to walk you through the major arteries. First, I start from left ventricle, which pumps oxygenated blood into ascending aorta. Before I continue, I want to remind you that the first branches coming from ascending aorta are the two coronary arteries that supply the wall of the heart. This model does not show them, but we need to acknowledge that coronary arteries are the first branches of ascending aorta. On top of aortic arch, I have three branches. I start with the right one, which is brachiocephalic trunk. I follow brachiocephalic trunk, and here it divides into two major arteries. The one that goes up is the right common carotid artery that supplies the right side of the head and neck. And the other one is right subclavian artery. We call it subclavian because it goes below clavicle. I follow the right subclavian artery, and here I get to the armpit area, so I name it axillary artery. Then I enter the arm, that would be brachial artery. Recall that we use brachial artery when we take, for example, the blood pressure of an individual. And when we get close to the elbow, we notice from brachial artery, we get two major branches. The lateral branch is radial artery. Recall that above the wrist, somewhere here, you should be able to detect the radial pulse. And the medial branch is ulnar artery. So we have radial artery laterally located, medial is the ulnar artery. So these are the major branches that we get from subclavian. Now I go back to aortic arch and focus on the middle branch. That's left common carotid artery. It goes up, and as you see, there are some branches from common carotid that they supply, for example, thyroid gland. They supply the structures that we have in this area, the cervical region. However, somewhere here, the common carotid divides into internal carotid and external carotid. Please keep in mind, both common carotid arteries divide into internal and external carotid arteries. The difference is the left common carotid artery emerges directly from aortic arch. The right common carotid artery is a branch of brachiocephalic trunk. So I follow the common carotid artery, and I see that in this model, I have a better view of the external carotid. For example, the superficial temporal artery is a branch of the external carotid artery. Recall that very close to the ear canal, we can detect the superficial temporal pulse. Or here, I have a very good view of facial artery. Recall that near the corner of the mouth, in mandibular region, we should be able to detect the facial pulse. But in general, if we follow the internal carotid goes inside the cranial cavity. So that's internal carotid artery that supplies brain, supplies the meninges of brain, supplies the inside of cranial cavity. Now, I go back down again to aortic arch, and this time I focus on the left branch. Left branch is the left subclavian artery, which if you follow the left subclavian artery, you end up with the arteries that are similar to what we discussed on the right side. So it's just important to note that the left common carotid and the left subclavian arteries come directly from aortic arch, but the right subclavian and right common carotid are branches of brachiocephalic trunk. Then next step would be following descending aorta. In this model, we do not really see the thoracic aorta. We see the part of descending aorta that is below diaphragm. So I focus on this one. Below the diaphragm, the first branch that emerges from the front of abdominal aorta is called celiac trunk. Celiac trunk has three main branches. One branch goes to the liver. We call that common hepatic artery. This one supplies liver with oxygenated blood. Also, common hepatic artery supplies part of the stomach, part of the pancreas, and the beginning of small intestine that is called duodenum. The left branch is splenic artery. I see that it supplies spleen. Recall, spleen is this organ sitting in left hypochondriac region. Splenic artery also supplies stomach and part of pancreas. And then the third branch is left gastric artery. That one supplies stomach, that is supposed to be here, and part of the esophagus. Below celiac trunk, I can see another branch coming from the front of abdominal aorta. That's superior mesenteric. And then if I go down here, I have inferior mesenteric. Inferior and superior mesenteric arteries supply different organs of the digestive system. Then when you go below superior mesenteric, you notice that laterally from abdominal aorta, we get the two renal arteries. They're sitting horizontally. Renal arteries send oxygenated blood to the kidneys, and we call that kidneys. Before sending the blood out, filter clean blood. Now, from renal arteries, I start going down, and I notice two very long branches. These branches are sitting through an oblique pattern. We call them gonadal arteries. In male, we call the gonadal arteries testicular arteries because they supply the testic. But in female, we call gonadal arteries ovarian arteries, obviously because they're supplying the ovaries. And abdominal aorta ends exactly here. When it bifurcates, name changes. The two branches of abdominal aorta, we call them common iliac arteries. When you follow each one of the common iliac arteries, you see that pretty soon it divides into internal iliac and external iliac. If you follow the external iliac, you see that it goes down and supplies the lower limb. For example, from external iliac, we get femoral arteries. Then when we get to the knee, in front of the knee, we have patellar arteries. On the back of the knee, we have popliteal arteries. When we get to this section, we do have anterior and posterior tibial arteries, and also we have fibular artery. What about the internal iliac? Internal iliac, as you can see, goes inside the pelvic cavity, and it supplies several organs that we have in this region. For example, urinary bladder or uterus of a female, or prostate gland of a male. I hope that you find the information in this video helpful.